Welcome everyone to the Schulich Feedback Championships on WSN, Western Sports Network. I'm your host, Kristen Shoesmith. With me is Chris Watling, feedback provider extraordinaire and former champion of this competition.
Thanks so much, Kristen. It's a pleasure to be part of this event. I'm really excited to see our resident talent in action today.
That's right, folks. We've got 5 medical resident finalists, each vying for the Feedback Cup.
So let's get right to today's action. And as always, we get to throw in the first ball. Who's on the field, Kristen?
Well, Chris, down on the field, Priya is about to give feedback to Alicia on suturing. She learned a lot last year, so we're expecting some great feedback now. All right, Alicia, show me how you've been doing your simple interrupted stitches. Okay. All right, before we get to the knot, let's stop there. I think you did some things really well, but do you mind if I show you how to do a throw? Okay, so let's start from the beginning again. I like how you held your needle driver. That was very well done. You had a good placement of your needle. I just want you to hold your pickups between your thumb and your index finger.
Okay, sorry.
Are you having trouble seeing?
Yeah, sorry. I thought all surgeons wore these. I can't see anything.
Okay, no, you only need to wear those if you need a prescription.
Oh, okay.
You can take those. It's
Thank
very
you.
important to see properly.
Yes, thank you.
All right, so what you're going to do is you want to evert the tissue. You want to enter with your hand with the needle at 90 degrees, and then you want to really supinate your wrist. Okay. Would you like to try?
Yeah.
Excellent. Well, Chris, what did you think of that feedback encounter?
You know, Kristen, I thought it was really great. First of all, Priya really took the time to observe Alicia.
Yes, I noticed that she did that at the very beginning before giving any feedback.
And then when she did give feedback, it was very specific.
And I liked the way that she gave the learner an opportunity to try the technique again.
That's so important. Ultimately, you know, what she did was a great example of coaching for performance change, and that's really what we're trying to encourage here.
Well, how about we watch the second event?
That's a great idea. Here we go.
All right, Stacy, so we're here to talk today about your internal medicine rotation that you did last month. Everyone really enjoyed working with you. The only point I had was that you have good knowledge of medications, but I think you need to work on your antibiotics a little bit. There were a couple of cases of pneumonia or UTIs where I felt you could have had a bit of a better choice of what antibiotics to use. So hopefully you can work on this for your next rotations.
Okay.
Any questions?
No, I don't think so.
Okay, thanks.
I'm not sure the learner really knew what the resident was talking about.
Well, it's a blur to me too. You know, it's not enough for feedback to be specific, it also has to be timely. You need to give feedback in the moment if you're going to capitalize on the learning experience.
That's right. Timely doesn't always mean immediate, but the sooner the better. If the experience is still fresh in the learner's mind, they won't lose the context.
Well, Kristen, what's up next?
How about we now watch Lauren coaching Patrice during an abscess, incision, and drainage.
Ooh,
there?
No, not like that.
There?
No.
You're doing it all wrong.
Well, tell me how to do it then.
Just do it better next time.
Oh,
Yeah, that's not ideal. Why don't we watch them try that again?
okay.
Like
No.
that. Oh,
No.
sorry.
Okay, all right.
Okay, so first of all, you need to inject a nice big wheel, but you want to minimize the number of pokes you do for the patient. You do want to try to get a good superficial as well as deep block because you want to have good analgesia. So what I have for you here actually is a sheet that takes you through the steps. So I'm going to get you to read this through tonight, get those steps all underneath your belts, and then let's meet tomorrow and practice it at the sim center before the shift. How does that sound?
Yeah, that's great.
Now, that was more like it.
I agree. That was really much more constructive feedback. It was constructive because it was what we call actionable. And actionable feedback means giving a learner the steps to improve rather than just telling them that they need to improve. She said, read this paper tonight, study the steps, come to the sim lab. There was a real plan for how things were going to get better.
Specific steps that they could take.
Specific steps.
Right, right.
Well, what do we have up next?
Well, our next interaction is going to be Charles giving Daniela some feedback on interviewing.
So after this patient interaction, can you give me some feedback?
Yeah, sure. I'm always down to do some coaching. Let's go in here. So how do you think it went?
I think that went pretty well. I mean, I was able to ask all of my questions and get the answers I was looking for and keep it within a really good time frame.
Yeah, you had a great sense of time, and efficiency always helps here. What do you think went less well?
By the end, she was starting to get a little annoyed with me, but I'm not really that good with kids.
It's great that you're attuned to the feeling of your patients. Next time, I would recommend just giving her a little bit more time to finish her thoughts. I mean, sometimes if you let a patient talk, they just give you what you need. Let's go see the next patient.
Will you give me feedback after that one too?
Yeah, that's how you'll improve, and by the time you're assessed, you'll be ready.
I really like how that went. I thought it
Me
was
too.
well done. Charles had a conversation with her and started by asking her how she thought things had gone as well.
Right, that's a great strategy because it encourages reflection. Asking someone what they thought went well, what they thought went not so well, it encourages reflection, gets people in the habit of doing that, and it actually really feels like a conversation with all the back and forth that is supposed to be involved in that.
Right. I think that makes it less like an assessment that somebody would be very anxious about and more like coaching.
Yeah, exactly. Feedback is not just something that you give to somebody, it's an interaction, a real dialogue between the people involved. That's kind of, I think, the heart of coaching.
Right. All right, should we move on to our last example of challenging or difficult feedback?
Josh, I've seen more of your underwear than my own. You are never going to cut it. Are you eating? You are never, ever going to cut it at LHSC. That is completely unacceptable.
Well, he really dropped the ball on that one, didn't he?
He sure did. You know, there are times you might have to give difficult feedback like that to coach a learner on appropriate attire, but that's not the best way. It's important to concentrate on the behavior, not make it a personal attack.
How about we watch them try it again?
Hey, Josh. Nice hot dogs. I'm not sure the patients want to see the underwear though, so just a reminder, we should have clean scrubs, have the pants tied up so we don't see your undergarments, and just a reminder, all food and drinks should be outside of the patient care areas.
Wow, that was a huge improvement over the first time.
This is probably one of the hardest examples here that we've seen. And to add to that, what we think of ourselves isn't always what others think. Sometimes we're not that good at self-assessment, and people who need feedback the most might be the least receptive to it because they just don't see themselves the way that we see them. The other thing is, you know, it's hard to actually hold learners accountable if we haven't clearly communicated our expectations. And I thought in this event, the expectations were communicated really nice and clearly.
Well, that concludes today's events. I'm not sure that a clear winner emerged though. What do you think, Chris?
Well, in my mind, they're all winners because they're investing the time to coach their learners. You know, admittedly, there's room for improvement in some of these events, but I think collectively, this was a great display of some of the key features of meaningful feedback. To be meaningful, feedback has to be specific, timely, actionable. It should be reflective and be made routine, and it needs to be directed at the task, not at the person. And I think across all of these events today, we really saw that in spades.
Giving feedback to someone is like saying, I think you have what it takes to do better. It really is a compliment to that individual.
It is.
You've been watching WSN, Western Sports Network. Good night.